Hi, I'm Jess Burke, Director of Marketing and Communications from the International Society for Heart and Lung Transplantation, and I am here today to share a little bit more about the 2021 winner of the ISHLT and ICCAC VAD Coordinator Career Development Award. This award is presented by ISHLT and the International Consortium of Circulatory Assist Clinicians and is made possible through funding by Medtronic. And the purpose of the award is to develop the role of the VAD coordinator in mechanical circulatory support programs around the world, specifically by funding outstanding studies proposed by applicants to the program. Today, I'm honored to be interviewing Janet Wu, the 2021 winner of the award, who comes from the University of California at San Francisco, and her project explores the impact of prehabilitation programs on LVAD surgical outcomes. Janet, thank you for joining me today.
Hi, Jessie. Thank you. Thank you so much for inviting me here.
Well, I'd love it if you would tell us a little bit about yourself. I know I shared a couple of details, but if you tell us who you are, where you work, and what you do, that would be great.
Absolutely. Hi, everyone. I'm Janet Wu. I'm a nurse practitioner working in mechanical circulatory department at the University of California, San Francisco. And my responsibility is to take care of a patient who is on mechanical device, which include ECMO, Impella, and LVAD. For our LVAD patients and candidates, our team provides holistic care from initial assessment and education to the OR LVAD implant to inpatient management and also outpatient long-term management. And I am primarily responsible for the inpatient care and, of course, collaborate with outpatient coordinators, LVAD coordinator, to provide the quality care to our LVAD populations.
Fantastic. Well, in your work, I mean, it's a little easy to guess, but can you tell us a little bit about how this idea for your project came about?
Oh, yeah, absolutely. So for the LVAD patients, we already know because they have like advanced heart failure for quite some time, and we know many patients actually develop very remarkable and physical dysfunction and cognitive dysfunction, and also at the same time they become very like a cachexia and have a lot of emotion stress in this whole process. So actually one day, I just do the inpatient rounds. I talked to my VAD physical therapist about the physical optimization for our patient, actually after the LVAD implant. But she told me actually she also worked at for the orthopedic patients. And for those patients, they do the prehabilitations before their orthopedic surgery. And I said, wow, actually, that's a good idea. Why not? We should do that to our patient population too. So I found out, so I get on the internet to search some relevant literatures, and actually found out, according to the American College of Surgeons, they recommend the patients to do the prehab before their surgery, even back in 2018. So I started to prepare the proposal and I talked to my director, and he said, that's a good idea, let's do it. And he actually recommended me to apply this ISHLT and the ICCAC VAD Coordinator Award. And we just got so lucky and we got it.
Well, it's good timing, and it's impressive how many wonderful pieces of research start with, hey, that's a good idea, let's do it.
Yes.
So can you go into a little bit more depth about the study? What will you be exploring exactly, and how will you do it?
Yes, so this prehabilitation project actually involve a lot of teams. So we are aiming to optimize patients' function before their LVAD implant. So we will collaborate with physical and occupational therapists, dietitian, VAD social workers, psychiatrists, to provide optimization intervention from aspect of physical function, cognitive function, nutrition, and emotion management. So the process is as soon as the selected meeting committee approve this patient will be the VAD candidate, we will conduct initial assessment on patient's physical, cognitive function and nutrition, as well as psychological function. So we will use a ISHLT test, such as a sit and stand, grip strength, 6-minute walk to assess their physical function, and also the MOCA test to assess their cognitive function, and use the labs such as pre-albumin level and iron saturation, A1Cs to assess their nutrition status, and use some tools to measure to assess whether they have anxiety, depression, or other mental illness. So, and based on the initial assessment, we will, of course, we'll start the prehabilitation project, the program, and tailor it to meet the needs of the patient. So first of all, our VAD coordinator will explain to the patient about this project and also our expectations, because it's kind of very important to let patient fully understand what they involved and what and why we are doing this, and of course earn their trust and collaboration. And second, we will implement, we will start the intervention spontaneously from those three perspectives, actually 4: physical, cognitive, nutrition, and psychological. Patient will do exercise at least like 20 minutes, 3 times a day, and with or without PTOT. For those patients who need the minimum help, so we'll encourage them to walk 1 or 2 miles a day. And for those who cannot tolerate such walk, so we'll provide the full pedaler so they can practice, they can exercise their calf and also the muscle in the leg. And at the same time, we'll provide the Robin stretch band, so they can do the exercise to practice the chest muscle. You know how important after procedure they need to take a deep breath. Those things count. So and also we will of course give a patient incentive spirometer, let them promote the pulmonary hygiene. But oftentimes we found out the patient don't know how to do it correctly. So that time we're going to teach them how to do it correctly, and so they're hopefully to practice their muscle to memorize, to remember that how to do it after. At the same time, so we're going to do the cognitive to improve their cognitive function or just say maintain. So we'll provide a tablet which has a games like Scrabbles, coloring, cards, something like that to keep the mind going. And then for nutrition perspective, if there's no contraindications, we'll give them the IV iron infusion, folate, or vitamin B12 supplement, and based on their level, the lab level, at the same time give them the protein boost, protein shakes if their albumin is low. So those things is our optimization strategies. And we collaborate with our VAD social workers to assess their psychosocial status. If our social worker raises a concern about anxiety, depression, or any other mental illness, we'll refer the patient to a psychiatrist so they can give a suggestion. And for people who are like above 65 years old, we'll talk to geriatric as well to prevent the post-op delirium and all other stuff.
Well, Janet, at the start of our conversation, you talked about your center as providing holistic care, and it sounds very holistic to me. A study like this could only come from a center that really focuses on treating the entire patient. So it's very thorough. What's the relevance of the potential findings of this study? What kind of clinical and research applications do you see coming from this work?
Yes, absolutely. So this study, our primary goal of this study is to test whether it is a good tool to improve LVAD implant outcomes. So very beginning, we'll assess the patient's physical, cognitive, nutrition status immediate before, even very beginning, before our prehab project, and also right before the surgery, so we can see whether we make any difference. And of course, after the patient have surgery and before discharge, we'll do the same measurement and see whether the patient how optimized they develop. So, and hopefully the patient have a better performance of a frailty test, and also increase albumin, pre-albumin and iron saturation level. And of course, at the end, we will measure our post-implant ICU and hospital length of stay. That's one of the endpoint we measure, and also see whether the intervention help to reduce any adverse effect, the AEs defined by Intermax. Yeah.
It sounds really exciting and like something that could help patients around the world. So I'm very optimistic for your success. Finally, can you tell us a little bit about the team you'll be working with?
Yeah, absolutely. So as earlier I mentioned that this team, I need a lot of collaboration among the teams. This project need a lot of collaboration among the teams, which include, of course, our MCS VAD coordinators, inpatient folks and outpatient folks, and nurses, including in ICU nurses and the nurses on tele floor, PTOT, social worker, dietitians, psychiatry, psychology, and also there's another thing is that I will collaborate with the IT department as well. So we're going to develop the order set just for this project, so it will be easier for our MCS LVAD coordinator to put the order in and initiate this project in time. So of course, every single team in this project, they play a tremendous important role, and their performance actually direct affect our patient care and the patient outcome. So, and not mention, we have a couple of high school volunteers from Berkeley. So they help us to record the videos about how to do exercise, how to do exercise before the LVAD and after LVAD implant. So everybody is being wonderful, and I hope our project will yield positive clinical outcome and the benefit of that patient and potential heart transplant patient and populations in the future.
Absolutely, and I love that you've gotten the entire team on board to pitch in for this. Well, thank you so much for joining me. I'm really excited to see what comes out of this, and congratulations again on receiving the grant.
Oh, thank you so much.
And it's my hope that we'll be able to check in with you, Janet, again next year after the study is underway, hopefully in person at the ISHLT annual meeting in Boston in April, or if we still need to do it virtually, just this way once again.
Sounds great.